All right, everybody. It is now 6:04. I want to be respectful of everybody's time. And so welcome to our all membership meeting, our webinar of the Practice and Policy Committee. My name is Elliot Hu. I'm the chair of the Practice and Policy Committee. And we have our committee leadership here as well, minus a couple of people who are on vacation and at conferences. So this webinar is supposed to be where a lot of the members, it's available, it's recorded and it's available for playback, but it's available for you, everybody to kind of chime in and discuss. And we do have some topics lined up and talks lined up for everybody too. But first, I'd like to introduce our Vice Chair, Dr. Michael Schwartzen. He's going to give some updates on potential member opportunities. And then after that, Michael, you can pretty much pass it off to Nehan and Sarah.
And Elliot, if it's okay with you, I'd rather go a little later when perhaps some more people will join. I know there was an 8:30 Zoom earlier today, so maybe some people will join later, and I want to make sure everyone knows the opportunities that they can join.
Okay, yeah, if that's what you prefer, I think that's a good idea. Why don't we start with Nehan then?
Okay. Hi, everyone. Thank you so much for joining. I am the chair for the Community Advocacy Group, and we are currently actually accepting applications for the Community Advocacy Award. And what I want to stress about that, and you can learn more about it in this week's newsletter that went out, but what I really want to stress about it is you don't have to have this amazing award. We're actually wanting to look for, we want to hear about all the projects that are going on around the country. When Brian and I are talking, we always hear about people with smaller projects that are so impactful or so innovative. And so it doesn't need to be some big, innovative, out of the box idea. We just really want to hear what people are doing. So we hope that you will take the opportunity to submit an application and just tell us what you're doing. And it's a good way to get the word out. And eventually we will create a map. And so we can put down what projects are going on around the country. And it's a nice way for people to see all the great work that's happening. So feel free to look at the newsletter and submit an application. Thank you.
Thank you. Brian, I think you wanted to give some updates on updated online resources.
Yeah, I just wanted everybody to be aware with the turnover in the calendar now that it's 2025, we've refreshed and updated the AMSSM advocacy resources, and they're available at the website amsssm.org, and there are there are a variety of resources available. I kind of am sharing my screen here just so you can see. There's a state map. If you click on legislation by state, a little map will show up that has all the legislation that's that we're tracking state by state. And right now the map is a little blank because it's just the beginning, right? In fact, there's several states that haven't even started their sessions yet. There's an updated legislative handbook with a message from Dr. Elliot Hu, our chairman, that's in there, along with a bunch of other resources that are specific to 2025. There's some kind of more longevity resources in terms of how to do advocacy and that sort of thing. So take a look at that. If you have any questions about any of the advocacy resources, reach out to me or to Dr. Hu, and we're improving those. There's a giant, if you haven't heard yet, there's a giant initiative at AMSSM to improve our website overall. And as the overall website is improved, these advocacy resources will kind of flow into that project. And I think over the next several months, you'll see some dramatic improvements rather than just the PDF, right, that's already up there. So take a look and then reach out if there's any questions.
Thanks, Brian. Dr. Cindy Cheng wanted to give a brief update on athletic training licensure in California. Please, Cindy.
Mute. Awesome. Okay. Hi, everyone. I started late. I jumped from publications committee over to this. So exciting news. Well, let's hope it's exciting. So last year we had AT licensure It got watered down to title protection, and that's really all it is. Not a lot of teeth, but people can't call themselves athletic trainer unless they really are a certified athletic trainer. Still no one really monitoring it. But at the end of February, we are holding on the UC Berkeley campus. Aspen is actually holding, it's called their Aspen Project Play. They have an annual meeting. I think Brian's very familiar with it. I'm actually going to serve as the AMSSM rep to it since that's right here in my backyard. But the Governor's Council on mental health wellness and physical wellness, or I forget the exact term, but it was set up by Governor Newsom. The first partner, his wife, Jennifer Siebel Newsom, leads. She's co-chair of the Governor's Council. They will be in attendance at the 2-day summit, which is in Berkeley. And we have mobilized UC Berkeley, the athletic training program, CATA, the CIF, the Sports Medicine Advisory Committee, but the executive director, Ron, we're going to be holding a lunch session during that 2-day event and hoping to get the Governor's Council members to that lunch session to talk about why athletic trainer licensure is so imperative for protecting youth sports safety, mental health, and physical health, wellness, and safety in sports, because their initiative is to Project Play revolves around an ACL, preventing injury and an ACL prevention program and some other things, but really the best people to be able to start those programs and to help guide the coaches and educate our athletic trainers. And so we're really hoping to use this 2-day conference as a natural launching pad to go again for AT licensure, and this time get the support of the governor so that once it gets there, it can be passed. So that's kind of where we're at with that perspective. That's the update.
Wonderful. Thank you, Cindy.
Mm-hmm.
All right. So
awesome. I look forward to Project Play, what comes out of that summit every year. So that's really cool. Thank you for that update.
all right. We do have some members here in this webinar, and so I'm going to open up the floor if any of them have anything to discuss, any issues that they want to bring to our attention, or if you don't have any or forget it, you can always type it in the chat as well. I'm monitoring the chat as well. So anybody have any issues that they want to discuss or anything that they want to bring to our attention?
I will say one other thing, and that is briefly, we were talking about trying to find malpractice insurance. And there were several of us that have a broker that has been providing us insurance through an insurance agency. I had a pretty long conversation, and Elliot, I think I emailed you about it, right? And he basically thought, and Brian, I think I CC'd you on that as well, thought it would be a good idea to somehow poll our membership, maybe at our annual meeting, which I think is the easiest way to do it if we put up a QR code on the rotating slides. Something like, did your malpractice insurance carrier drop you? Do you want to cover events locally and you can't find someone to cover you? To be able to get a sense of how many of our members are uninsured, underinsured, who want to be covered, because as we all know, insurance is cheaper if you have a larger volume of people that want to be insured. And he gave me some really good tips about how we could try to figure out whether or not this is even something that our members want. So I didn't really hear back from anyone about that, but I'd like to put it back up on the radar. Maybe Brian connect with you, Elliot connect with you, in terms of figuring out what our needs are for our members, and then whether or not it would be beneficial, because he certainly, so for example, I am being covered by this personal medical malpractice plan for me to cover elite athletes. So I'm covering USA athletes with this policy. I'm covering, you don't have to be that specific to tell you the truth, but when I got this policy, I specifically said this is for travel with athletes. and sometimes overseas to international events. And he essentially said, as long as you are only caring for athletes that are from the United States, so when they file the lawsuit, it's filed in the United States, and that's it. So just to tell you, my event coverage is like 20 hours. I think it's like 20 hours a week because I have a small, like I cover the Berkeley rep and some other things locally at the Berkeley High School. And I pay 40, like $600 a year for that, which is still a chunk of change. But if you're able to negotiate or somehow, if we can get that down lower to meet our members' needs, perhaps that will be helpful for our membership. So I would love to kind of get a sense of, do we want to do something with this? Do we want to do something at the annual meeting to be able to get a straw poll to see what our members need? Because if we want to do something like this, we have to start thinking about the slide and I need someone smarter than me to devise I'm sure I could do it, but a QR code and associated with a really short survey. Or maybe we can do it through our evaluation, that we do. I don't know. I don't think we want to do that. But thoughts from anyone?
I think that we've been talking about this since I was a fellow. Like we've been talking about this for 20 years, right? And so I'm glad that you have this conversation and a relationship. And I think that's great that we're moving this forward finally. I think it's awesome. So thank you.
Yeah,
Sure,
so
but I need help.
yeah, I completely get it. I know, I still remember that you sent me. I did bring it up. And so my concern was that, you know, is AMSSM as an organization sponsoring, like, or directing, members to this specific, carrier, right? So that was my concern. But I think you bring up a good point. I think it is a big issue. A lot of us who cover, we are dependent on our employers for malpractice coverage, and if they say no, then we're kind of stuck on our own. And so, not exactly sure of how to kind of approach this, but I think that a survey is a good idea too. At least a need survey to say, well, is there actually a need, or how many of our members actually have this need? And then we can kind of pursue it from there too. I'm not exactly sure how to pursue that in terms of an organizational standpoint, but certainly, if you and I and everybody else, and people who are interested want to get together and work on something like this, absolutely, I'm happy to help out.
I don't think that he's looking for sponsorship. I think that he had said, how do you see this looking? I think, again, a broker will make money regardless of whether or not they're sponsoring or whatever. But if we feed the people, he would like to be able to say, though, to the insurance carrier, hey, there are 1,000 people, or there are 500, sports medicine physicians that are looking for coverage. And this is the scope, and the things that be included were the things I sent you on the email. Like, are we looking at high school? Do we want to cover a D1 team, like what Tony said? Do we want to, are we looking to cover elite athletes? And I know that we were all also concerned of, like, if you accept payment to do event coverage, does that set you up for increased liability, et cetera, et cetera? And absolutely, but if you have insurance, it doesn't matter, right? And then you could potentially then make some money to cover the cost of your insurance. But that gives you a secondary, like, sigh of relief, like, hey, this is part of my giving back to the community. And sometimes you can actually, by doing that, you can get in-kind services as well. So whatever that would be. So for example, I cover a local theater company here and I volunteer my time. I have personal medical malpractice to cover that. I get benefits like associate sponsorship of a particular play where I'm, given tickets for opening night. And I, get wine and biscottis before a show. I mean, again, it's really that feeling of being part of a community, right? Oh, I get free advertisement, although it doesn't really matter to me, because I'm in the publication as a physician, resource for the actors. So, I mean, those are the things that we can be creative and proactive with to help. And there's something else that came in on chat. Yeah, and I totally agree. Malpractice is really a hurdle for those wanting to help on the high school sideline. Absolutely.
Yeah, I'm one of those. And so, I've been exploring this for a really, really long time too. Brian suggested that we could have something at the advocacy table. Let me talk to Carly and Andy Kusman and Will Day on the program planning committee, see if we can get, at least some sort of survey out there. If people are interested, then they can certainly supply the data.
Yeah, I mean, again, a QR code, a very short survey. I think that Neha, I will find the email and send it to you too, so you have a sense. But yeah, I mean, I think that if we could put all our collective minds together, make something really short, have a QR code, people who are alerted to it, who see it, can take a picture of it and then fill it out. I think that would be really valuable information that we can at least get started with. And honestly, we can move that into a study. We can move that into a paper. Whoever's interested, if you need a publication, I am sure that we could do something with it. But that's where I'm going to stop with saying what we could do. But I do think that it's certainly a need that we have in terms of our membership. Okay.
Perfect. I'll forward Neha that email right now. Let me just look for it. All right. Anybody else have any issues that they'd like to discuss, or any other discussion points? Okay. Well, thank you, Cindy, for that important update and the discussion as well. We're going to move on now to Dr. Kinsella. She's going to give a talk on legislation and advocacy. And then if you guys have any burning issues or discussions, please put it in the chat.
Awesome, thank you. So I do have a short presentation about tips for legislative advocacy as we're coming into the new sessions here. It's probably about 10-ish minutes, but definitely there's a small group here. If anyone wants to chime in or have questions while I'm talking, go for that. Elliot and Brian, when I'm sharing my screen here, I can't really see the chat. Or people kind of raising their hand or whatever. So just please let me know if someone wants to talk. Sound good?
We'll let you know.
Thank you. Awesome. Can you guys see my screen now?
Yeah, it looks great.
Looks great.
Yes.
Awesome. Okay.
Yes, that's
So,
great.
Short presentation on just some practical tips for legislative advocacy. And I do want to give a shout out and thank you to Dr. Fairgrieve, who again is climbing Mount Kilimanjaro, which she was super helpful with this presentation. So there are many ways to be involved in legislative advocacy. So nationally, Brian is preparing for AMSSM Welcome to Congress meetings, and I'm going to talk about those in a minute. Locally, there are a lot of medical societies and community organizations that often have local advocacy days or initiatives that they're running that include kind of instruction on advocacy, handouts, information on specific local bills. So I would encourage you to get look at the organizations you're involved in and see what's available. The organizations on the screen are some of the organizations that Katie and I are involved in. So obviously AMSSM has a lot of resources. I'm a pediatrician, so the Minnesota chapter of the American Academy of Pediatrics has a local advocacy day. The Minnesota Medical Association does as well. A lot of our priorities align with the American Heart Association, which is very active nationwide as well. And then Katie had a few organizations on here that she interacted with when she was in Utah for her fellowship. So you can use like AMSSM resources if you're advocating locally too. So that's why they're out there and available. Every organization kind of determines their advocacy agenda in a different way. And a lot of these places only have finite resources. So there's a lot of issues that are important, but every organization kind of defines, here's the things we're going to work on this year. But if you kind of remain active, you can kind of connect the dots between these organizations, and these local organizations can still help connect you with legislators. So, personally, I try to connect annually with the lobbyists for all the organizations I'm involved in, like, hey, what are you guys working on? And, sports medicine topics aren't always at the top of their agenda. So I kind of offer myself as, hey, here's what we're doing nationally. Keep me updated if you hear anything. And they're good resources to say, here's a, representative that would be interested in talking about that issue. So that's kind of my strategy every year. So nationally, there are 12 new senators and 66 new representatives in Congress from 31 states. And Brian is coordinating these Welcome to Congress meetings with our state key contacts to kind of introduce sports medicine and what we do as an organization. Here are the 2025 state legislative sessions. So you can see they're all at various different times, but try to look that up if you're interested in interacting locally. I do think it is important if you're meeting with legislators to prepare a little bit before your meeting. For an organizational advocacy day, sometimes you don't really have to because they have this system in place to help you be successful when you're meeting with people. This was the MMA day from last year. You kind of show up, there's a lot of speakers, they talk about their legislative agenda. They often have handouts, and they do note kind of specific bills that you should note. It is important to understand the system. What does your local system look like? And know who represents you. So this QR code is a way to find your elected officials. And reviewing a little bit about them too, website bios, what committees they're on, that can be kind of important when you're meeting with them to make those connections. If there is a general advocacy topic that you're interested in talking about, bring some handouts. This is a QR code to all of our AMSSM issue briefs. So these are specific handouts that touch base on different topics. So we have them on ADHD, concussion, emergency action plans, Good Samaritan protections for team physicians. So if there's something you're particularly passionate about and you want to talk about that with the legislator, bring these handouts. Bring business cards. These can be really helpful to kind of leave with them for further information. Brian touched on this in the beginning, but AMSSM does have these resources on our website. So there's a handbook and then the state legislation tracking map, which is updated. So if you're not sure if there's any sports medicine related legislation, you can check out this map and see what's going on in your state. If there is a specific bill, it's really important to know that bill title, the author, the committee that it's going through. Your legislators do not know every piece of legislation that's being introduced. And even if they're on a committee, they don't have medical knowledge. So knowing what that bill is, reading it, clarifying things, that can be really important. Trying to think. This is an example of a local bill last year that MMA was advocating for. So they have the specific, Senate and House titles. So I knew exactly kind of what to bring up when I was talking to my legislators. Confirm your meetings. So emails, confirm multiple times and also be really flexible. So this is me advocating last year at the Minnesota State Capitol, and I think my meeting time changed about 3 times when I was there. I would get text messages, can you come here? And an email, can you change the time? So it is really important to be flexible in those situations. Remember that most meetings are really brief too. So you really only have a short period of time to kind of get your views across. Introduce yourself and educate them on your background and expertise. It's okay to brag. Tell them, who you are, what you do, how you're connected nationally. This one's hard for me. I'm from the Midwest. You don't like to brag, but telling them your position, how long you've been working, other things that you're active in, what is your expertise is really important. I also think it's important to connect with them. So especially if you're meeting locally at the state level, these people live in your communities. So they might have connections to the schools your kid go to, the gym you work out at, your clinic, other organizations. So you can share that information too and build those connections. When you're talking about advocacy or something that you're trying to get accomplished, storytelling is really, really powerful. So I know in medicine we really like data, but people really do connect to stories. So if there's a particular patient or a particular issue that you have a story about, that can be really powerful. So last year we were advocating in Minnesota for continued access to telehealth. So, I would talk about, one of my clinics is a north suburb of the cities, and a lot of my patients are travel from rural places. If they're elderly, they don't necessarily have access to the internet, and so having the ability to have telephone call to connect them to care is really important. And then after the meeting, following up is really important. So follow up with an email, send any references that you talked about. Just make sure that you're thanking them for their time and following up with everything that you discussed. So just some take-home points from this talk, like AMSSM along with your state and local medical societies can help facilitate these local connections. Your legislators want to hear from you. They represent you. So figure out who they are and try to meet them even during an advocacy day or just on your own. We all have knowledge and expertise about a lot of topics that legislators don't know about. So use that, and storytelling can be a way to do that. And then involving kind of multiple organizations or stakeholders, that's really key to kind of getting things accomplished. We've also created this community and legislative advocacy handout that kind of outlines this advocacy framework. So if you want a copy of this, we can send it to you. I think it will be available online as well. And then there are some other resources at the end of that and here, other sources that we used to put this together. So that is all I have today. I would love to hear from anyone here with any examples from their legislative advocacy or examples of their pitch or how they talk to their legislators.
That was a super talk and an overview, and really appreciative. And I would, a couple tips is, I'm also from Ohio, so from the Midwest, is introduce yourself as doctor, because you just have to push that, be proud. I also have to say I was surprised that I was with a male colleague, and the amount of the interns and other legislative aides who only looked at my male colleague and not at me I was flabbergasted. Now, I was, 15 years his senior, but I probably maybe didn't look that much older. But again, speak up, and if they just address whoever your colleague is with you, go ahead and say, oh, and I'm, whatever. The last thing is, it's still very formal. So I know we're used to being more informal when we're getting in front of, our community or whatever. But in the state capitol, wherever you are, you will see that people are still suits, at least in the environments that I've been in. So really be formal or wear a suit when you are in the hallways. That's been my experience. I don't know if anyone else has any feedback.
At the MMA day, they encourage you to even wear your white coat. And I know many of us don't anymore, but that is, more formal, and again, can be just a way to show like, yep, I'm a doctor. This is my, this is what I wear. So they encourage us to bring our white coats.
I'll say from the East Coast, we're kind of humble too, though. I will say that. But they they say, don't even say doctor, because everybody's a doctor right now. And so they said you have to put the word physician somewhere in the first paragraph. And they like gave a script and everything, because everybody's a doctor.
I'll add too, for any kind of trainees on the call, I think sometimes you can, and I think Sarah emphasized this really well, but I think sometimes you can be worried that you're not enough of an expert in some of the topics that you're going to be advocating on. And I think that's where doing a little background or participating in one of those advocacy days can be really helpful because you have the resources in front of you. But also give yourself some credit. I remember I did some advocacy days through the American Academy of Pediatrics as a medical student and resident. And felt like I wasn't going to be able to contribute to the conversation, but you work with patients every day, and I think it's easy to forget that these legislators have to know a little bit about so many different things that you're just day to day. The fact that you're in clinic seeing patients makes you such an expert, and those stories will come really naturally.
The other thing that I would say, and this is Lauren Simon from California, the other thing I would say is if you are bringing the handouts and fact sheet, make sure to leave them at the end and not hand them to them first. Otherwise, they won't pay attention to what you're saying. So that's a really important point, is make your points first and then say, right, that I want to leave this information to you.
One of the things that I learned early on, particularly when I moved into health system leadership, it's always best to build the relationships with your local representatives over time. And so the advocacy days are great, but imagine if you had a regular call with somebody from your local representative's office, whether it's the local, state, or national. If you're working for a large organization, there is somebody in government affairs who can help set those up and doing that kind of stuff. And so now when I go to Capitol Hill for advocacy stuff, I usually look for Dr. Jeff Van Drew, who is our local representative from the southern part of New Jersey. He's a dentist who meets with us on a regular basis locally here at home, and he takes the task of introducing me to his colleagues around Congress. And so having those relationships helps. One of the things I've also found is that they have medical needs too, and occasionally they show up in your office and they don't always tell you who they are until after you're done. And so I've met a lot of folks that way that have just been incidental conversations for things. And so I think that's the biggest takeaway I have after doing this for 20 years is that, believe it or not, representatives and elected officials are people too, and really do just want to have a conversation.
Absolutely, that's super important. You know, you can connect on things again outside of medicine and outside of advocacy too. Two of my former state senators and state representatives were, you know, one of their sons now plays basketball with my son. You know, so like they are living in our community. So we connect about other things, and then it's when something occurs, you know, that I need to, hey, can I pick your brain about this bill that is happening somewhere? How to go about this? Then you've already had those connections over time with people in your community. So
I will say this is these have all been positive comments. Here's a negative comment, and that is have an answer ready for everyone that you've met with who then contact you and say, please support my whatever. Because I will say money. People here, if they know your physician, then you begin to be someone on their list of supporting their reelection or supporting their whatever. And I will say that that's what makes politics a little bit distasteful is it seems like it's a tit for tat. Like if I don't support you, then are you not going to support this bill that is really important to medicine? I don't know how many other people have had that experience, but I certainly have, at least locally, with my representatives. Anyway, you know, what do you do, right? So just be prepared to be positive. I've always tried to tell the truth, but try to be like, hey, yeah, send me, let's reconsider that, or I'm going to be let me talk to my partner about it, you know, in terms of what we'll be sponsoring and who we're looking at, or whatever you want to do, but have an answer so it's not no, but it's certainly very positive. And whether or not you end up supporting their reelection bid or supporting all their pet causes as well. Because when they hear your physician, it's like, even though we're primary care.
I'll throw out a possible an answer you can use. So you're obviously you're individuals you can choose to support or oppose whatever candidate you want. But AMSSM, we're nonpartisan and we're not political at all. So you could easily say, look, I'm here on behalf of American Medical Society for Sports Medicine. It's a 501c3. They don't get involved in electioneering or politics. I'm just here to educate you on this important sports medicine policy. So that's a go-to. But I agree with Cindy. You wouldn't believe the number of lists I'm on after all these years. Oh my goodness, it's painful. So be prepared for that. You will get a few emails as far as
Oh, that's great. It's great to say I'm on the advocacy committee for AMSSM, and we are not permitted to in my role.
Yeah. A couple other
Maybe
things.
we could put that out too, right? For our members to know.
Yeah, no, that's a good idea. I don't want to discourage anybody. Obviously, if you want to be politically motivated, go for it. It's a good thing, and I enjoy it. It's something I've enjoyed my whole life, and some people do and some people don't. But a couple of other things when you're meeting with one of the concerns I hear from time to time is, what if I'm asked a question that I don't know the answer to? Hey, what is your position on the Medicaid expansion bill that is currently under debate? And if you don't know, it's fine. It's perfectly fine to say, I don't know the answer to that. I'm a sports medicine physician. I know everything there is to know about sports medicine. I'm a terrific resource for sports medicine. This other thing, I'm gonna have to go back and find out. Call Brian. I'm gonna call Brian. He'll tell me and I'll get back to you. It's perfectly fine to say that. You don't need to be a subject matter expert on everything that's going on right now. So that's a concern I hear from time to time. And then I just want to reiterate, when you're in a meeting, if you're in a meeting, be sure to ask them to do something. Don't just have it be sometimes they try to get away with just having a friendly meeting, but be sure to ask them. If it's nothing more than just, will you read these materials, and then follow up. I think Sarah mentioned that. Follow up with them to say, did you read this? Did you have a chance to get to the thing that I asked you to do? That follow-up is important, and I think as you follow up, it helps build that relationship that Dr. Reed talked about.
The other piece that I'll say to that, and again, I can only speak for the institutions that I've represented as either the chief medical officer or now as SVP and quality and care delivery and other stuff like that. We have some regular standing relationships, and every health system in the country gives money to some political body. It's just the nature of doing business as a health system for things like Medicaid expansion and other stuff that comes up. We give equally to both Democrat and Republican in general. Regardless of where we're at in the country as well. Even in the city of Philadelphia, there was 90% Democrat we gave to both parties, because you never know when it comes. What we loved having was a cadre of specialists of a variety of nature, and so I kept my sports medicine colleagues close, even though I am sports medicine, as a local expert. I kept my urologists close as a local expert. I kept my surgeons close. And so if you're working in a system like that, and I've been in both academic medical centers and community hospitals, your chief medical officer is looking for people like that, like you, who are interested and willing. We don't censor anyone. We don't tell them what to say or not say. Again, I can only speak for my institutions. But we know that we get asked questions on a regular basis, and we're already donating, so they don't tend to ask the individual physician for money when it comes to campaign time. They tend to come back and ask us. I also, even when I do the introduction to Senate or introduction to Congress with AMSSM, I let my political affairs person know that I'm having that meeting, because she's had a long-standing history. In some cases, she's helped to get them into office. And so, Brian, when I emailed you last week, those are some of the people that we've helped get into office in New Jersey. Or have been around New Jersey politics for a long time with my person. And so that helps with the relationship and with the ask as well. One of the reasons they like it for re-election is, when you think about it, they have 2 years to get something done, but it resets every year. And so bills and stuff that they have started gets reset if they don't get it done in certain states and certain representatives. And so it becomes this continuous thing that it may take them more than 2 years to get stuff done. And so they can't get it done if they're only there for 2 years. And so there is a whole myriad of stuff that happens behind the scenes when it comes to the institutional stuff. And for us, it's really keeping the plaintiffs' attorneys at bay because they donate a whole lot of money to legal causes.
Yes.
It's the Philadelphia thing and the
Yeah, what I will say is that, I certainly don't know everything. And when I was in the summertime, when I spent some time with Jim and Brian in Louisville at the National Conference for State Legislators, I think, there are many times when I said, hey, I don't know, but hey, Brian, can you answer this? Or can I direct you to Brian? And so he certainly was a very good resource in terms of the stuff that I couldn't answer. So there's always help. And I was always prepared to say, well, I don't know, but let me look that up and I'll get back to you. So I think that's a powerful thing to say where, where you admit that you don't know, but then you're willing to look it up. And so hopefully it made a difference. I'm not sure if it actually did with some state legislators, but hopefully it made that difference.
I want to reiterate something that Sarah said. You do all this work, you spend all this time prepping to meet with these legislators, and you think you've got this convincing story and these amazing points and arguments, but this is the time to be patient. Like if you read any book on an elevator pitch, it says all you want to do is create this relationship. It's not getting to yes. It's not, oh my God, you've convinced me. You're never going to convince somebody in 20, 30, 40 minutes. You just want them to hear you. And so that way they do some of their own investigating. And so this is not the time to be like, oh my God, tell me if you're going to support this and how can you not? Just be patient. Give them the time to do their own investigation.
Any other comments or discussions?
The other thing I'll throw out there, just thinking about that, is it's rarely the principal who has funded knowledge or the interest. It's usually one of their staffers. And they'll have a host of staffers who come from a variety of backgrounds or are responsible for a variety of things. And so it tends to be the relationship with the staffer that pays off more, because then they go and do the research and find more information and do that and give it to the principal, who then has to make the decision of how they're voting or what they're sponsoring or going from there.
Right, and if you make them, especially, they're young, right? They are young. And so, especially if you make them, like, really show them respect and how much you value the time meeting and their opinion and everything, that is very helpful, rather than say, oh, I thought we were going to have an opportunity to meet with Senator. Rather than say that, say, well, we are just so grateful that you had the opportunity to meet with us, and you build them up. That is very helpful as well. And again, it's authentic, right? You don't just say it to be gratuitous. But certainly they are there to learn, and hopefully they're civic minded and they want to contribute to the community. So acknowledge them for that.
And they're also, that's their full-time profession. And so when their principal loses the election and a new one comes in, they get a job with a different representative. And so they tend to be there longer than the elected.
But the thing is, right, everybody plays sports, or everybody's somehow involved in sports, either because they play sports, their kids play sports. And so there is it's easier to make a connection in this realm than in most any other realm. So you have an in.
I would say that, except Jerry Brown did not. And he was our governor for a long time, who did not sign the athletic trainer licensure bill. So,
okay, most people.
right.
There's always one.
All right. Do we have any more discussions or any other talking points?
Brian was reminding me that some states have a Doctor of the Day program. I go every year. I know I went when I was in Kansas as well. It's a great way when you go, especially if you get a legislature that you're with that's social. They'll, one trip up there and you can meet 7 or 8 legislators, and it's usually a very laid back type job because you're their doctor. You're not there in a lobbying capacity, so you don't have to lobby. You don't have to worry about talking about any specific thing you're worried about. You can just make the relationships that later translate into discussions as you can be a resource. Once people find out what you do, and a lot of us do pretty amazing things, they gravitate towards you because they all have their sports injuries and their questions about taking care of teams. So if you're interested and you're not sure exactly how to contact the people you want to, lobby for these practice and policy issues or whatever your personal issue is, another route is to volunteer to be doc of the day. I know in Florida, the FAFP pays for the whole trip for you. So yeah, you might lose a day of work, and it may be a little far. Miami is a little far from Tallahassee, so I do lose a little bit of work time, but it's a very rewarding and enlightening trip. So it's something you guys can look into.
Wonderful. All right. Any other discussion points from anybody? Okay.
Elliot, do you want to go back to my list of current opportunities?
Yeah, I think if we don't have any other things to discuss from the membership and the attendees, then yeah, let's go through some volunteer opportunities and then see if we can wrap it up from there.
I know there's not too many on here, but you or someone you know may be interested in trying to be more involved, not only in practice and policy, but in AMSSM in general. And we have several opportunities available. One of them is I'm trying to compile employment negotiation and contract issues. We're not trying to be lawyers and give legal advice. What we're trying to do is give practical tips that members have had, usually their errors, right? And we try and teach everyone from our own mistakes so you don't make the same ones. I haven't made too many, so I'm hopeful that other people can share some of their horror stories or success stories in helping the future fellows and our current members negotiate their practices. Community Advocacy Subcommittee is trying to get highlights on local sports medicine advocacy efforts. I think some of that was discussed. So if, again, especially people from the Midwest, if you don't like to brag, we get it. But highlighting the good that you do is important, and sending it to Brian or Elliot so we can publicize it so other people can see what you do. And again, you can be inspiring or you can be a copycat. We're all here to try and promote sports medicine and wellness. The Legislative Subcommittee is looking for more state legislative key contacts from Louisiana. So if anyone is in Louisiana, knows anyone there, Brian would very much like to make a connection in Louisiana so we have someone there that we can help advance our practice and policy issues. The Innovations in Practice and Policy Subcommittee is looking for writers to create issue briefs to educate policymakers on important sports medicine policy topics. As some of you have said, the legislatures come from all different backgrounds, and you can almost assume they know nothing about medicine, and what they do know is probably wrong. And trying to come up with a layman's description of certain issue briefs from our point of view can be very helpful. And splitting the work up amongst people is also beneficial. The practice and economics subcommittees looking for writers to help create publications that explain the value of sports medicine. So similar to the issue briefs, we're looking for members to highlight the value of specific therapies, procedures, but instead of for advocacy purposes, this is for insurance companies and payers to show how important what we do is, what's the evidence for it. So, and part of that is also to explain the billing and practice, the billing for our members. And lastly, if you remember the Choosing Wisely campaign, the Healthcare Transformations and Quality Initiatives Subcommittee is looking for writers to help create sports medicine best practice publications to augment what we already have. So if you think you have an idea for a best practice in sports medicine, you could contact Elliot or Luis or myself. We will, it doesn't have to be perfect. Just give us an idea and we'll see if we can roll with it. Brian, Elliot, am I missing anything? I got the thumbs up.
That was great.
We got it all covered. All right. So any other questions from any of these or committee leadership or discussion points? Well, I'd like to thank everybody for showing busy. It's busy winter season, and hopefully, winter coverage, is still going on right now. And there are lots and lots of webinars going on. So thank you for showing up. Thank you for attending this webinar, and thank you for your input.
Could I ask a brief question? And this may have been part of the publications committee. I'm not sure, but has there been thought process about how to, Brian, there's always a pretty good turnout at our annual meeting, but part of our website, et cetera, is being able to put a banner like joining committees and things like that too, but getting active members, because like Michael had a whole bunch of stuff that'd be great. We need committee involvement. We need members who want to be more involved with AMSSM to participate in various committees, and this is an important one. And so kind of how to involve newer members, how to involve fellows, residents, et cetera. Have we talked a little bit about how to get that recruitment off the ground at all?
Yeah, McKenna, do you want to talk about your project?
Sure, yes. Hi, everyone. I'm McKenna. I'm the current fellow liaison to our committee. And I have been working on a trainee engagement kind of ideas project. And we have compiled a list of trainee opportunities for engagement within all of the AMSSM committees, and that will be published in the upcoming AMSSM resident and fellow newsletter that will be coming out, I think, sometime in the next couple weeks. And so we have been thinking about ways specifically to get trainees more involved, both within our committee and the other AMSSM committees. But I'm definitely open to suggestions on how we can work on increasing engagement as well, because I think it's something a lot of us acknowledge would be really beneficial, but I think it takes some creativity to find ways to get people interested and engaged.
I would also just like to share one short thing. And one of the things that we ask when we do our fellowship interviews, and so maybe we can start talking to our academic partners, meaning the residency committee or fellowship committee, et cetera, is that we do ask, and we do it really subtly, but one question is like, what committees have you been involved in at AMSSM, and why did you select them? And another one, I'm just sharing this with you guys. Another one is, don't share our trade secrets, but and the fact is, having that ability to look it up and make sure that they're telling the truth, but you can kind of tell, like, another question that we may ask, we don't always ask it every time, is, 10 years from now, you're at an AMSSM meeting, and, which committee or committees will you be part of and why? And so we try to do that to let at least our fellowship candidates know that this is really important. We feel like this is an important part of someone who's going to be in a fellowship is that we want them to be involved in their organization and we want them to contribute. But I'm just wondering if that could be something that's emphasized, like through the fellowship committee meetings or through the residency meetings or something like that too. Is that some programs look to see if you were involved at AMSSM, as a resident and things like that too, and how involved were you? I don't know, just a suggestion.
Yeah, and I've been in conversations with the communications committee. I've been looking at this for a while now, and so I know that there are committees who don't lack membership involvement and volunteers, and then there are certain committees who are smaller, and then we're always looking for help. So I've been talking to the communications committee in terms of how do we kind of bridge that gap? How do we blast out all this information for everybody so that we're not just saying, well, you need to come to our committee and help out. So we're working on ways to do that. But with the whole IT change and the IT modifications and upgrades, we're kind of brainstorming right now. But it is on my priority of list to do as well. So I mean, there have been lots of ideas thrown out previously too, just in private conversations, and how do we do that, and as a discussion, and how can we make this a better product for everybody too. So yeah, we're definitely working on it. It's a frustration of mine to see, well, there's many committees out there with great membership engagement. I'm like, oh yeah, good, I'm happy for you. But in a committee that we're struggling for volunteer support, how do we support each other, and how do we improve this process too? Wonderful. All right, so I will take note of all of this, and any other.
And one thing I want to just say for those of you, I know we got about 20 people on the call or so. While you see 20 people on this call, recognize that we have state key contacts. We have at least 2 state key contacts in every state except Louisiana, right? So we've got over 100 people that are involved. Beyond that, we also have a number of other people who get involved doing some of these virtual Hill visits and those kinds of things. So we've got a lot of people that are engaged with this committee, whether or not they're on these calls. So don't ever be discouraged when you're on a call like this and you say, oh, we put out a call for the whole membership and we've got 17 or 20 people on it. Recognize that you've got well over 100 volunteers that are, advocating on behalf of the organization and doing good work related to the committee and everything you're seeking to do. So always keep that in mind.
Well, thanks for the reminder, Jim. That's something that I always tend to overlook because those are the people who work behind the scenes as well. All right, everybody. It is 7:01, and any other discussion points, talking points before we wrap it up? All right. Thank you, everybody, for joining us. This will be recorded. This is recorded, and it will be available for playback. And then Brian usually always sends out a summary afterwards, too. So.
And responding to Tony, I.O., Tony, I.O.
Thank you, everybody.
Stay warm.
Bye, everyone. Thank you.
Bye, guys. Go Chiefs.
Thanks, everyone. Have a good night.
Take care.